Now we move to a discussion of something that impacts far too many Americans, and that is the problem of hunger in America. How many people in this country are still going hungry every day, including children? And what can our country do to address this problem, not only here, but around the world? To discuss this important topic, I'd like to bring on our guest right now, Katie Martin. Katie is the CEO of More Than Food Consulting, LLC. She is a doctor, a PhD, Dr. Martin. She's a thought leader with 25 years of experience in anti-hunger work. She's also the author of a brand new book titled Reinventing Food Banks and Pantries, New Tools to End Food Hunger. So she is the exact person we want to speak to today about this issue. Dr. Martin, thank you so much for joining us. How are you?
I'm great, and I appreciate this opportunity to speak with you and your audience.
Absolutely, absolutely. First, tell us a bit about the work that your organization does. Tell us a bit about yourself.
Thanks. So More Than Food Consulting is a brand new consulting firm, and our goal is to promote a paradigm shift in our approach to tackling the preventable problem of hunger in America, and even more broadly. And this paradigm shift is moving away from short-term transactions of distributing food to more holistic and comprehensive solutions that foster long-term food security. And I've spent my career focused on creating programs and conducting research on evidence-based programs to tackle food insecurity and to promote health and nutritious food.
That's wonderful, Dr. Martin. So let me ask you this. What is the current status of hunger in America? Can you give us an overview of what the situation looks like? The good, the bad, the progress, the backsliding? Where are we right now?
Right. So every year, the U.S. Department of Agriculture releases data on food insecurity. It's about a 1-year time lag. So they just released data this September based on food insecurity rates from 2021. Really during the height of the pandemic. And it found that food insecurity had not significantly increased or changed from the prior year, which is good news. Yet about 10% of US households struggle and worry about getting enough food for their families at the end of the week or the end of the month. And that's just unacceptable. And I would suggest that the good news of the reason why it didn't increase so dramatically during COVID was because of a lot of interventions, primarily from the federal government to increase benefits, to reduce barriers for receiving federal food assistance, other additional supports. And we'll talk about that in a minute with the White House conference. But the other thing to note that food insecurity affects communities all across the United States, but it disproportionately affects certain groups of people, predominantly single mothers with children and people of color. And we know that this isn't by accident, that there are systemic inequalities and structural inequities in our society and our policies and our programs that make it more difficult for certain groups of people to get ahead and have access to enough food.
So tell us about what the White House is proposing to do about some of these problems. They're having a summit today. Is this something that is going to be a positive? It's going to have a positive impact? Is it just kind of starting the conversation? Tell us about the White House summit and what you expect from that.
Well, I'm an optimist by nature, and I'm very hopeful that this White House conference will result in substantive policy change and programmatic changes that I hope it's not just talk. It's particularly exciting, I think, because this is the first time in my lifetime that we've had a White House conference. The first one was in 1969, the year that I was born, 52 years ago. It's taken that long to reconvene a White House conference. So it's critical. And the first conference in 1969 resulted in some really substantive changes. There were increases in the food stamp program and the development of the WIC program, Women, Infants, and Children, because it was recognized that there were vulnerable groups, particularly women, pregnant women, infants, and children, that would benefit from nutrition assistance. That WIC program came out of the White House conference. So I'm hopeful that there are substantive changes that will take place. The Biden administration is proposing public-private responses, so not just changes within federal food assistance programs, but also partnerships and buy-in from corporate America to make it easier for people to access and afford enough food. They are not just focused on the issue of food insecurity, but also looking at nutrition security. So making sure that nutritious food is more readily available, affordable, accessible. Also looking at activity levels. So we know that food insecurity, chronic diseases such as overweight, obesity, type 2 diabetes go hand in hand frequently. So that not only providing access to nutritious food, but also opportunities for physical activity in communities where folks are most vulnerable.
Dr. Martin, can you tell us about a little bit more about COVID? What were some of the interventions the government engaged in to help things not get worse? For example, the child tax credit. Can you tell us about what impact that may or may not have had in addressing the issue of child hunger?
Yeah, it's huge. And I appreciate you bringing that up because that's also one of the hopes from this conference is to extend that child tax credit. It's critical. And I think some of the early analysis was that by implementing and offering this child tax credit, we could cut child poverty nearly in half. That's, you can't overstate how important that is for the most vulnerable, for families with kids, to have that additional economic support to be able to make ends meet. Other initiatives that they're discussing is increasing eligibility for the SNAP program, what used to be called food stamps, the Supplemental Nutrition Assistance Program, increasing eligibility for the summer food service program. So when school is out, families that rely on school breakfast and school lunch during the school year can access additional school meals during the summer when food insecurity often spikes. Those are just a couple examples. During COVID, there were many such bureaucratic changes that took place to make it easier for people to access food and other supports. So things like an eviction moratorium, making sure that people weren't going to be evicted if they couldn't pay their rent, pausing student loan payments, making it easier for people to save up the money that they need in order to pay for groceries, pay for other necessary expenditures. There are so many things when we think about food insecurity, it's so closely linked to poverty. And so by addressing poverty alleviation, we make it easier for people to be food secure.
Now, Dr. Martin, we've talked a lot about what government can or can't do to address this problem. What about the private sector? Anything you'd recommend there that would help address the issue of food security? And even beyond that, beyond corporations, anything that individuals, can be doing or should be doing to try to help to address this problem?
Mm-hmm. So I think we so often think that, and the government should play a big role in this. And I think part of the advocacy here is increasing the federal minimum wage. So that when people are working, they're doing their part, that they're getting a living wage to make ends meet. The corporate sector can do that on their own. We've seen that, especially during COVID. It's been more challenging for businesses to hire enough staff. And so they've done that on their own. They've said in order to attract good talent, they need to pay people more. Imagine that. We should pay people living wages. Providing benefits. So often, in order to make it easier for their bottom line, corporations will often pay folks for part-time labor so that they don't have to pay for health insurance and benefits. And then those costs fall on the rest of us in society when people can't afford and access healthcare and healthy, nutritious food. So the corporate America and the private sector can pay living wages with benefits. There are other opportunities in terms of providing access and donating healthy, nutritious food to food banks and to food pantries. That's a lot of the work that I've been focused on in the last few years. is within the charitable food system of how do we make it easier for people to afford healthy food and free food as well.
Understood.
And in terms of individuals, what individuals can do, there are many opportunities to get involved in your local communities, whether that's helping to volunteer at a local food pantry. In my book, Reinventing Food Banks and Pantries, I provide lots of action steps that you can take in your community today.
Wonderful. Well, Dr. Martin, I want to thank you so much for your time and sharing this expertise with us. Anything else you want to share with us? I mean, I'll just throw this question to you. You've covered a lot of potential solutions. I think we've hit so much. I'm sure there's more. But if there was one thing, just one short-term thing that you think needs to get done in the near future that could really address the problem, is it the tax credit? Is there something else that can be done short-term to make a big dent in this problem? Private, public, or otherwise?
Well, not to be too pithy, but vote. Your vote matters. All of these initiatives that we're talking about that the Biden administration is proposing, most of these will need congressional approval. So the folks that you elect into the House of Representatives and into the Senate make a difference. And so ask your local politicians how they feel about food insecurity and making sure that people can access healthy, nutritious food, and then vote for those who will support these types of initiatives.
Dr. Martin, I want to thank you so much for your time today, and thank you for covering this serious and disturbing issue. It's so sad that this is a problem in America, given the wealth our country has. So we thank you for the work you've done to address it and for sharing your expertise with us today. We hope to have you back in the future to, God willing, share some positive news about progress in this fight.
Thank you very much.
Thank you, Dr. Martin.